Here we are, turning 65. What are the Medicare choices? A few of the benefits that we offer are an unbiased look at over 20 different insurance companies. Having an advisor on the ground. That means that we're in the field, working with people, talking about Medicare every single day. Our job is to stay on top of new rules, regulations, and changes that might affect you. We review your coverage every year to make sure you're not stuck in a plan that might not cover something you may need for next year. And best of all, there's no cost for our help. We represent all the major carriers and have access to many others. Now, today we will cover Original Medicare, what Medicare covers, your choices, a Medicare Advantage or a Medicare Supplement plan, what a Medicare Advantage plan is and how to compare them, what a Medicare Supplement plan is and how to compare them, Part D prescription drug plans, and all of the important enrollment dates. Well, before I begin our training today, I want to introduce myself. My name is Rana Draysat. I was born in New York, and I was raised in Downey, California. I've been a licensed agent since 2009, and I've been an independent broker since 2013. Our team has helped thousands of individuals enroll in health plans. Now, before I go any further, I did just want to reference that all of the information I'm going to be giving you today is right out of the Medicare and You handbook. If you don't have a copy, you can go online and view a copy of it electronically or order one from Medicare's website. This is the official U.S. handbook that has all of the necessary information you need to know about Medicare in it. It's just a rather dense reading material, so I've simplified things to help you make more sense out of it today. So let's dive in. This page is right out of the Medicare and You handbook. So let's start with the basic parts of Medicare. What are the parts of Medicare? Well, you have Part A and Part B. Those are the original Medicare hospital and medical insurance. Later, Medicare Part C and Part D were added. You can see that Medicare Part C is not listed on this page because it's also known as Medicare Advantage, and we will discuss that separately. And then Part D is your prescription drug coverage. So let's get started at the top and talk about what is Medicare Part A hospital insurance. First off, some things to know about Medicare Part A. Most people are eligible at age 65. There's no cost for Part A as long as you've worked for 10 years or 40 quarters and paid taxes into the system. Medicare Part A works with any hospital that accepts Medicare nationwide. Your benefits will restart after you are out of the hospital for 60 consecutive days. So it works on a per hospitalization basis, not per year or per benefit period. You also have what's called lifetime reserve days. Once you've used those days, they'll never be available again. I'll talk about that here on the next page. So, if someone has original Medicare Part A coverage, Medicare is going to cover 90 days of inpatient hospital care. So if someone is hospitalized, what are the out-of-pocket costs? Well, first of all, you have what's called a Medicare Part A deductible that you would have to pay per hospital stay. So, if you were in the hospital anywhere from 1 through 60 days, the deductible is $1,408 for this year, for 2020. After that, Medicare picks up 100% of the cost. Now, if you happen to be hospitalized for more than 60 days, then on day 61 and thereafter, through day 90, you'd be responsible for a $352 copay each day. So someone with only original Medicare coverage, if they were to be hospitalized for a 90-day stay, that could potentially be $11,968 out of pocket. Now, once we hit day 90, that's when those lifetime reserve days come into play. So if someone is admitted inpatient to a hospital beyond 90 days continuously, Medicare has what's called lifetime reserve days. That's where Medicare will pick up the cost except for $704 of each day of that stay for those additional 60 days. And if these numbers look expensive, they are. Medicare does not have an out-of-pocket maximum or a cap on what the beneficiary could be exposed to pay. Now let's take a look at original Medicare Part B.